NNIP folder, and you can choose the PDF or the PowerPoint.
Okay, do you have a preference for PDF or PowerPoint?
It doesn't matter.
Okay, great.
Should I have a preference?
Okay.
Okay, this is a 2-minute warning. Because there's just 3 of them, so it's like 15 minutes. And we need to do this. Okay. And then is there a break?
Okay, I have to load this presentation they just.
Yeah, we'll make sure.
It would be better if like
End it. If we can end it 1:55. Yeah. Okay. Should be like 15 minutes of presentation, 5 minutes of question, and a couple minutes early so that we can do this switch.
yeah, that would be great. I have everything loaded except for this presentation that I had tonight.
Hello, hello. Okay, we're going to get started in 1 minute. So this is your final warning. Okay. Okay, welcome back, everyone. It's time for our first NNIP showcase presentations. So these are going to be quick fire presentations. We're bringing back a tradition because we have 2 new partners of the new partner showcase. So we're going to first welcome our Durham, North Carolina partner, and that's John Killeen and Tim Stallman, who are going to come up and do a 5-minute presentation all about their organization and everything they do and everything they have to offer.
It's going to be so fast. Hi, I'm John Killeen. I work for DataWorks North Carolina, and this is Tim Stallman, who's with me right here as well. And I guess we're going to go ahead and jump right into a few things about who we are. We're a nonprofit organization, a 501c3, that's based around these core partnerships that are listed up here. We've been working with the city of Durham for a long time, and now we have these basic groups behind us. The United Way of Greater Triangle and the Triangle Community Foundation are also on our board. Some of our primary goal is empowering the partners that we work with in the community organizations, and informing their organizing and the public policy advocacy that they might do, led by expertise and voices and leadership in neighborhoods.
All right, so we want to talk a little about the history of Durham. Durham started as a tobacco and textile town. It was founded in 1869. A lot of its first residents were poor black and white folk who were driven off the land when sharecropping and small farms ceased to be a viable model and moved to the city to seek employment until about the 1920s. And the last tobacco factory shut down in the early 1990s and was rebuilt as a mixed-use sort of startup incubator space in the early 2000s. And so Durham's really going through a quote-unquote revitalization right now. It's one of the fastest-growing areas in the country with job growth in the high-tech industry, but has created sort of a stratified stratified society where there's a ton of new people coming in who aren't aware of the history of Durham and often have social connections amongst themselves and have a lot of disconnection from existing neighborhood structures. So that's actually posed a lot of challenges for our work in terms of the traditional sort of like neighborhood organizing structures that one would work with are kind of not losing a lot of their ground, and we're focusing on educating folks on history.
All right, so between the 2 years that you see here, the population of the city doubled, of the county doubled from 132,000 to about 270 or so. And one of the other key things, this was driven largely by the growth in the non-white population, particularly the Latinx population, which is about 14% now. The other thing that happened, you might be able to see on there, is a huge push of that population out into the periphery of the city, out of the inner city. But during the same period of time, there are neighborhoods that lost population, and that was really driven by some of the things that Tim just mentioned, too, the change in industries and also the destruction of key housing communities as well, too, whether it's for university campus development or for the redevelopment through HUD projects.
All right, so what do we do? One of our big projects right now is mapping health indicators. For the first time ever, we're getting disaggregated chronic disease incidence data at the block group and tract level for the entire city. This is based on raw patient counts from Duke University Health System, which sees 90% of patients in the country. And we're finding that the numbers we're getting there are like 50% higher than the Burfus numbers and we'd love to talk to anybody who knows anything about that in this room later about that. Here's what we're doing. We're doing a workshop curriculum to work with most impacted neighborhoods about what they ID as the things driving health in their neighborhoods, and then you develop metrics to try to display those things to the community as a whole. And we're building an info sheet app. We're working right now on developing this that will take the data we have and then combine it we're trying to look to more like qualitative data-driven visualization, so thinking about like text that's data-driven and also illustrations that are data-driven. So we're working with an illustrator right now to develop a modular framework for combining different data-driven illustrations.
And we're also trying to look at the structural causes beneath the things as well. And so when the City Council asked for a report on gentrification back in 2016, we started to ask questions about community vulnerability and displacement as well, and how to put numbers on that, because that was part of the conversation that couldn't really get answered very well. So we're talking a lot about what the history is. It takes decades to build gentrification, basically. So looking at how land devalorization has occurred. And this has prompted us to look at evictions as well. You've heard already this morning about how we're part of a statewide look at this, but we're looking at summary ejectments from the Sheriff's Department for 5 years that show where the neighborhood concentrations are based on commercial apartment complex development and housing authority locations as well. But at the county level, every month there's a wide variation in seasonal turbulence kind of in the volume of summary ejections that happen. And this chart kind of shows that too, that every year, I mean, across the board, they are going down, as Ashley referred to, but there's a huge variation in seasonal fluctuations that if you took out just when tax season happens here, though, when the tax returns come through, there would be a much more stable experience for people in terms of if they had income to pay for the rent. And so anyway, another thing about the structural level of this is just that there are concentrations where ownership, types of forms of ownership also influence where evictions are happening the most. And that's something that we're digging into now with the sales of commercial apartment complexes. And we're also trying to summarize all of these processes about how we understand what the things are that matter the most, how people use that information, and how we communicate it more powerfully publicly into a program called the Durham Lab, which is more about the qualitative experience of data and a sort of three or four part program that allows people to engage it and use it.
Okay, so if anyone has any questions about that, save that till the end. We might also give them some time to elaborate on anything. That was 5 minutes exactly. So next we have Katie Pritchard representing our Milwaukee partner. So if you want to go ahead. Again, everything about the organization and history of Milwaukee in 5 minutes.
I'm going to start before it does. Good afternoon. I'm Katie Pritchard, your partner from Milwaukee, and I'm pleased to present this update from Data You Can Use, where our tagline is, from people you can trust. We're honored to be part of this network, and we often use this slide to demonstrate the geographic spread of our partners. We're the one on the Fresh Coast, and I'm going to give you a few minutes of past, present, and future data you can use. Some of you may remember that this is my second time being a new partner. We have a strong belief and a long-standing tradition that data is the key to success. This is how Carrie and I looked when we came to you last time. We've updated our image, though. We see ourselves now as a much-needed link between those who have data and those who need data as we pursue the NNIP mission of better data, better decisions, and better communities. Our business model is also updated. Now, with Carrie and I serve as the core team, but we rely on a very broad and diverse group of people who have expertise in qualitative and quantitative skills as they are needed. And we've expanded our conception of partners now as we think about those who support our work, as well as those with whom we share staff, share space, and share data. I'd like to highlight some of the recent projects that we're working on. First, the Health Data Users Group, affectionately known as HUG. It began with a small group of people interested in integrating health data into their neighborhood work. They were very used to talking about crime data and very good at talking about housing data. But they knew health had an impact, and these things had an impact on health, but they didn't know the people who were connected to that data or how to talk about it in the context of their neighborhoods. We've grown from fewer than 20 people interested to more than 100 over 3 meetings, and the participants pick a topic, and our goal is connecting them to neighborhoods and public health data. A second big project that we're working on has to do with expanding the list of indicators that the city uses to describe neighborhoods. Traditionally, they went with market value analysis and included things like sales price, foreclosure, and vacancy. Now we're working with a diverse team, to expand the indicators of our neighborhoods and crossing the bridge to a broader conception of neighborhood conditions by learning from the work of our neighborhood partners and others. One approach that looks pretty interesting is the Neighborhood Livability Index that's been developed and put forth by AARP, and I'm really curious if anyone in the room is doing more about that. Another big project that we're working on is our involvement in the Turning the Corner project. Here's a place where our partners are involved both in data sharing and in overlapping projects. To give you just an example, this map highlights the overlapping boundaries of a transit-oriented design study, an anti-displacement study, an equitable development study, and our own Turning the Corner. These are both challenges and opportunities with this population, with these studies. One of the things we have done with our Turning the Corners involved a photographer who tells stories. This is the story of what was once affordable loft spaces for artists that's now transformed into luxury apartments where the artists are priced out, but ironically the building is called the Artistry. I've listed some of the other projects we're involved with, and I would be more than happy to talk about any of those with any of you who are interested, but I think that the range helps to illustrate why our business model really requires a diverse consultant pool with a wide range of skills and abilities to relate to diverse audiences. We've also been called upon to talk about the selection of good indicators in collective impact work. And this has led to the development of this slide to discuss different uses and purposes of indicators so that people don't use them for inappropriately measuring their efforts. This is also my plug for a camp session. In the future, at the end of this month, we have our 4th Data Day coming up. Our theme this year is Bright Spots. It's an approach that identifies positive deviance in the data. And if any of you are interested in that, I'd love to talk about that as well. We'll be doing Ignites, Skill Builders, a panel on what neighborhoods really want to know about the data. And the highlight for many is our Data Dream Contest, where neighborhoods submit their proposal for data assistance and get judged by a celebrity panel for $5,000 of data assistance. And in the future, we will be hosting the 2019 NNIP meeting in Milwaukee, a chance for you to enjoy our lakefront, our riverwalk, our neighborhoods, and our nightlife. We're looking forward to hosting.
Great, thank you so much, Katie. So I realize now my introduction to the entire panel was a little bit misleading because we have an existing partner Luke Schuster from the Boston Indicators, who's going to come up and speak, though this is his first time. So if everyone could give a warm reception, let's get ready.
Here we go.
Great, thanks a lot. Boston Indicators is a research center housed at the Boston Foundation, the main community foundation in Boston, and we're trying increasingly to do research in real time that supports the work of program areas. So this work came out of a conversation with the director of our health and wellness program, realizing that not only is the opioid crisis a huge issue nationally, but actually when you look at opioid-related death rates, the problem is twice as bad in Massachusetts. So what some of the data show? This is just national data. We see that opioid-related deaths nationally have skyrocketed, over quintupled since the year 2000. And also just note the increase in recent years from 2013 or so, there's been an acceleration of that increase up to 42,000 deaths nationally. Some sort of context for what those numbers mean, I think these are just striking comparisons. Roughly the same number of opioid-related deaths in 2016 as there were AIDS, HIV deaths in 1995, which was the height of the AIDS epidemic. More opioid-related deaths in 2016 than from car crashes. Driven by the opioid epidemic, American deaths from drug overdoses were greater than, ran out of time, you get the idea. Comparing Massachusetts to the United States, we see in 2016 more than twice as many opioid-related deaths in Massachusetts, which I found really surprising. My sense coming into this was that the opioid crisis was driven largely by economic conditions, and Massachusetts is a relatively wealthy state compared to the rest of the country. This just drills in Massachusetts by race, and we see, interestingly, the Black and Hispanic death rates were relatively similar to the national death rate overall in these earlier years, but we see a real spike for the Black and Hispanic death rate in recent years. So this is just to show you, this is not just a white issue, especially in Massachusetts. Unfortunately, people of color are being affected by this crisis increasingly. So what did we do in this research? We plowed into data to help support or debunk some of the theories about why Massachusetts might have this high rate. Ultimately, some of the unlikely suspects were economic conditions. This doesn't seem to explain why we have a higher death rate. Doctor-prescribed opioids definitely play a role, but we don't seem to be prescribing more than other states. Heroin doesn't seem to explain the difference either. The main likely suspects running out of time. So let's go through the data behind these. The left-hand table looks at cities and towns with high opioid-related death rates in that first column, correlated with relatively high unemployment rates. So it explains why they might have higher opioid problems. But if you look on the right-hand column, this looks at change in recent years in the unemployment rate. And those communities have seen actually more of a decrease. So that just can't explain why there's been an increase in the death rate. Here we just see the data that shows Massachusetts per capita has a relatively low opioid-related prescribing rate. So can't quite explain why we would have a higher opioid-related death rate either. Maybe I can take a breath while we wait for the next one. Heroin, another theory was that, well, maybe folks are using heroin more in Massachusetts, especially in the earlier years, making people more susceptible to the opioid crisis, but there's just not a strong difference between the Massachusetts rate and the national rate either, so this doesn't seem to explain it. So next, we'll get into some of our theories about why we actually think this is happening. The big one has to do with the increase in fentanyl. So fentanyl, for folks who don't know, is a synthetic opioid, much more potent than the traditionally prescribed opioids like OxyContin, and mostly what's happening here is illicit production of fentanyl getting into the street drugs and is much more deadly. Massachusetts, third highest in the nation in terms of fentanyl-related deaths. Again, this is really explaining the very recent increase. Take a breath. So the other big issue that we found is that there really seems to be a regional factor in play in New England. This just looks at all the New England states on the left, and you can see all of us have a higher than average opioid-related death rate. And then on the right, I've highlighted the New England states among the highest fentanyl-related death rates, and you see almost all of them very near the top in the United States in terms of fentanyl-related deaths. And then this last map is a sort of visual representation of some of the key Northeast drug trafficking routes. So this is way outside of our area of expertise, but it does seem like talking to folks on the ground, like there is just something happening with drug trafficking routes, especially with fentanyl getting produced in China, coming in through Mexico, and somehow traveling up the East Coast to New England, and it's created this sort of unfortunate hotbed that helps explain why our crisis is so much more potent, unfortunately. Thanks.
Thank you so much. The 5-minute time constraint is really rough, but now we have a period of Q&A, so 2 questions. Yep, I'm gonna time them. So if anyone has any questions in the audience right now, right here in the back.
Hey, thank you. Hi, I'm Nisha Bochway. I'm from Georgia Tech. My question is for the last presenter. Thank you for a whirlwind presentation. I was struck by the slide that highlighted Hispanic and African American death rates. I understand the opioid epidemic to be impacting specifically, or in large part, 25 to 44-year-old white males. And so I wonder what the rate is for, or what that line looks like for white males or for Caucasians in general, and relative to what you have present.
Yeah,
Is it on?
Okay, great. So this slide, again, is just Massachusetts. Oh, the timing's going.
Table, at the very top, front table.
All over the place.
So I think in Massachusetts, the white opioid-related death rate is in the mid-30s, so that gives you some context. It's higher in 2016 than the Hispanic and Black rates, but they are closing the gap, unfortunately. I'll say one really interesting thing that came out of our research on this. There's a theory about what's changed in the earlier years of the crisis to the later years, which is that in the earlier years of the crisis, most of the folks who were getting addicted to opioids were getting it initially from a prescription from their doctor. And there's a theory that there was a weird sort of positive effect of racial bias that doctors were having, in that they weren't empathizing with the pain of people of color in the same way, so they were less likely to recklessly prescribe these pain medicines. So it's sort of helped communities of color be less affected in those earlier years. And then as the crisis has sort of moved to the streets through the illicit fentanyl, the sort of street drug dealers are sort of less biased in that way, and the rates have caught up. It's a weird story, but it seems like it might explain some of that uptick in recent years, unfortunately.
Oh, we have a break, Olivia, so we can let it go a couple minutes extra.
Okay, so then more than 2.
We have a
Okay.
break scheduled, so go ahead.
I also have a Boston question. So in Massachusetts, they had legislation that was passed that kind of allowed/required data to be integrated across state agencies to look at this exact problem. Can you talk a little bit about that and how that helped the context of, or maybe not helped, how it affected the context of this research?
Yeah, so I don't know much specifically about that legislation, but I think related to that is the Department of Public Health did a big report a couple years ago plowing into what's going on with the opioid crisis in Massachusetts. And actually, reading their report is what sparked the set of conversations that led to this. So buried deep in the report was this comparison of the Massachusetts-related death rate to the Massachusetts opioid-related death rate to the national death rate, showing that we had twice the death rate, but no one was talking about us having such a more potent problem. So we were just really curious about what would explain it, and it was a jumping off from that research that led us to do this.
Kathy?
I have a question. This is for Katie and John. So both of you are so focused on resident voice and community organizing, and both of you are associated closely with the universities, which may or may not have had good relations with the community over the years. Sort of how are you balancing that, or is that not true in your cases?
Oh, sorry, I'm just moving.
You'll get an answer from both of us.
Like an answer for both of you.
You want this one?
Yeah. It is a really, I think, important question, and it's part of the rationale between our HUG group, the Health Users Group. Because we're located in the School of Public Health, part of what we're trying to do is bring people from the neighborhood into the School of Public Health and have them be at the same session with faculty from the School of Public Health. And I wish I could say, I think we're more successful at bringing the neighborhood people in than we are at getting the faculty to be engaged. And I will even say in this room that in some cases the faculty who have been involved have done more damage by reinforcing stereotypes about the distance between people in the community and the purpose of their research. And so it's a long haul, but I think it's worth it.
I think I can just basically endorse those thoughts that Katie shared. It's a challenge, I think, with all institutional groups in communities, really, whether it's government or universities. There is a history of policy or of research and extraction and things like that that we all kind of engage with in some way, or we represent blindly. And I think that the biggest challenge is just to be in this space, to make it a mandate for ourselves, to say that we're going to embrace it or look at it face to face and call it out, and at least be the first person in the room that says that, and also come back the next time and keep coming back. And that's the other thing I think that happens with research and with government, that you'll show up when you have a grant deadline, but you're not there for the hard work. And that's why I think being connected to organizing is what we need to do.
Other questions?
Okay. Any last thoughts? Anything you didn't get to in your 5 minutes? Okay, great. I think we're up for a break right now, quick break, and then we'll have our Atlanta-specific panel. Thanks, everyone.
Man, that's crazy doing that. You just
Nice job, nice job. It's hard going so fast, isn't it?
It's so fast.
and you prep thinking 5 minutes is fine. You're not doing something long, and it's just.
But the thing is, you could talk about like any slide for the 5 minutes,
No, exactly,
right?
yeah,
Like if you feel like it'd be not getting cut off if you like talked only 5 minutes about a slide. But actually, I from a communications person got the math on it, and so each slide is 32.5 seconds words.
Okay.
32.5